to suggest that we shift priorities. Our focus in Boston and what should be in the country right now is on public health. It's to listening to our medical community. It's about doing the right thing now and in the difficult weeks ahead. Our focus should be on saving lives, preventing the spread of the virus, because every single life is worth saving. I also want to be clear, there's no other options. If our health system gets overwhelmed, there will be serious implications to this. There is no economic recovery without public health, and there's only one way through all of this, and that's to test our resolve, and Boston certainly has what it takes. Over the last couple of weeks, we've taken time to shut our schools and libraries and cancel events. That's why non-essential industries are physically closed. That's why I ordered construction to pause, and it will remain paused until the City of Boston restarts it. We will be releasing some guidelines when work does return on what will be expected in the City of Boston as far as construction guidelines. That's why yesterday the governor issued a stay-at-home advisory. Everyone who can stay at home, we're asking you to stay at home. You should stay there, except to go out and pick up essential items, or maybe take a walk for mental health break to be able to get some air outside of your house. We're asking people to continue to stay 6 feet away, practice social, physical distancing. We're asking people to continue to wash your hands and sanitize your hands throughout the day with soap and warm water, or use hand sanitizer. We're asking you to keep all surfaces clean and disinfected. That means doorknobs in your car, if you go out in your car knobs, and making sure that as you go out, if you can wear gloves, just because we want to keep you safe. We know that this isn't easy, particularly physical distancing is very hard, and the economic impacts are hard, but it's an all-hands-on-deck approach. And we're going to continue to support the people of Boston and the businesses of Boston, and we're going to continue to support each other through these very difficult times. We are working around the clock to help the most vulnerable, our seniors, our low-income families, our homeless population, our kids, all of our neighbors. That's why we hired the McChrystal Group to work to analyze our plans and strengthen our protocols. I spoke to General McChrystal yesterday, and we're getting input every single day and seeing what we've done and the plans we've put in place and how do we continue to move forward. We're preparing for whatever it takes, and I have some updates today on some of our responses. The Boston Resiliency Fund has surpassed its initial $20 million target in a little over a week of fundraising. We're still accepting donation, and that's an incredible testament to our community. We're already using these funds to buy thousands of Chromebooks. We now have over 18,000 of those laptops in our students' hands, and we continue to distribute those laptops to our kids in Boston. We are releasing $5 million in grants to the following organizations that serve very vital needs. They include senior and low-income food providers. The Greater Boston Food Bank, that supplies and supports food pantries across the region. Ethos, which delivers Meals on Wheels to 8,000 seniors. This will allow it to serve more people. Fresh Truck, which will work with partners to deliver fresh produce and household needs. Community Servings, that provides healthy meals to critically ill people and their families. Project Bread, their food source hotline, is a statewide resource for people looking for food resources, and the demand is extremely high. The grants and funds are also supporting health care for vulnerable populations. Boston's Healthcare for the Homeless is screening and testing and operating its new medical tents that we created next to our shelters. The Boston Medical Center will use the grants to care for patients, support staff, and sustain safe hospital operations. And Pine Street Inn will increase cleaning of their facilities and work with the Boston Public Health Commission to staff quarantine sites for the homeless. I want to take a minute to thank the steering committee and all the donors. We're going to keep the fund growing, and 100% of the money will continue to serve these kinds of needs. For more information on donating or applying for funds, please visit boston.gov/coronavirus. And to be clear, if you're applying for this money is going to meet the needs that are assessed right now today in combating the coronavirus. For our small businesses, yesterday I signed an order lifting the City of Boston's ban on plastic bags during this emergency. Right now, we're allowing and helping restaurants and essential stores to provide takeouts and deliveries, and we worked with the state on passing legislation up there to lift the beer and wine restrictions, is allowing people when they order takeout to have that option. That has not passed legislature yet, but I want to thank the legislators who are working on that. Our businesses need flexibility right now to serve their customers, so restaurants, pharmacies, and other essential stores can offer paper and plastic bags no charge to customers. So we're going to do everything we can in the immediate right now to help our businesses to be successful and to keep them open, and we're going to continue to working with them. We're also working on a range of additional supports for our local businesses. I want to remind everyone, you can find directories of open restaurant and businesses at boston.gov/coronavirus in the local resource section. I encourage businesses to sign up, and I ask residents, if you're looking to get food delivery to your house, make those calls, go on that guide. These are businesses that need the help, and if you're going to do takeout, you could look around the city to see what's available. I'm also asking people to check our guidebook for businesses to see how they can use delivery services for workers to get hired in food delivery right now. So we're working to connect opportunities with these businesses as well. For our students, that I already mentioned, we have over 18,000 Chromebooks in the hands of students. We have over 70 meal sites continue to operate across our city. I've heard from BPS that some of our immigrant families are concerned about going out under the stay-at-home advisory. I want to reassure them that it's safe to visit these sites, and people who are supporting you also want to help you. We continue to get amazing support from volunteers and community members. One of our nonprofit partners that has stepped up in a big way is Katie's Closet. They've supplied 500 toiletry packages to each of our 16 BPS emergency meal sites. That includes feminine products we provide free in school for girls and young women. We're also working to continue the wraparound care that our schools provide. For medical personnel, I want to just start by saying a huge debt of gratitude and thank you for the incredible and difficult work that you're doing every single day, and to your families for supporting all of us. The same goes for our first responders, our Boston Police, Boston Fire, and Boston EMS, the custodial staff that keeps our buildings clean and safe, the grocers and pharmacy workers, the transportation and public work employees. I want to thank everyone on the front lines of this crisis. It's never been more clear in our lives that we live with heroes all around us here in Boston, and quite honestly, I can expand that to the Commonwealth of Massachusetts too. So thank you all the first responders throughout the Commonwealth. Transportation supports are in effect for hospital workers. We have discounted rates in commercial parking garages. The garages are listed on our website, so you can get the access code from your hospital for your work, or you can contact your hospital as well. Blue Bikes we made free monthly passes for hospital staff. We're reopening stations that were closed for the winter, and the bikes are being disinfected regularly. But I still ask you, if you take a Blue Bike, my suggestion is you wear a pair of gloves when you're riding it. Even though we're cleaning them, you just don't know to be safe. And starting today, the MBTA is adjusting commuter rail schedules to get more trains into Boston for the 7 a.m. shift. For emergency workers with young children, we now have 27 emergency child care centers operating in the city of Boston. They are for workers in healthcare, public safety, and essential industries. You can find them listed at boston.gov/coronavirus. Some updates on getting trusted information, and this is probably the best way to get your information, other than, as I said yesterday, watching it on the news or getting it from one of our papers. You can we have text message alerts going out daily in 6 different languages. That number is 99411, and text the message Boss COVID. The word Boss COVID, text it to 99411. You can also find codes to receive messages in other languages. We have information on 10 languages available on boston.gov/coronavirus. Let me be very clear. I kind of said that too quickly. We have 6 languages on our text messages, and we have 10 languages available on bos.gov/COVID, so people can get that information that you need. Today, we launched another new information service in the form of our COVID-19 dashboards. They are a visual toolkit that tracks the growth of cases and testing and other key information. They are linked with our website, so anyone that wants to find information, you can go to your website, go to the cityofboston.com website, and you can put in COVID-19 and the dashboards will be there. I'll conclude with some reminders. City Hall is operational, but we are discouraging visitors. Most of our services are now online, and if you need to come into City Hall, we're asking you to call 311 to set up an appointment before you come in. Please follow the Boston Public Health Commission's guidelines on what to do if you experience symptoms. Don't go straight to the hospital or doctor's office. We're asking you, first of all, isolate yourself, call your doctor, your primary care, or call 311 and we'll hook you up with the Boston Public Health Commission. Mental health has certainly been a concern for many people right now, so we're asking people to be kind to yourself and your loved ones. Get fresh air, stay safe, exercise. Make sure you reach out to folks through phone, through FaceTime, through texting, just to check in on people to see how they're doing. And if anyone feels vulnerable or scared right now and doesn't know where to turn, you can call 311 in the city of Boston, and we'll hook you up with somebody to talk to if you need that help. It's an important time that you take care of yourself, and if you feel alone or scared, please call 311, because there's a whole bunch of people in the city of Boston that are here that love you and care for you and want you to be safe and want you to know that we're right behind you. All of these calls are anonymous counseling, by the way, so when you call, anonymous counseling on the phones. We're here for you. We're grateful for all that you're doing and sacrificing people in this terrible time that we're going through. We're going to get through this together, one day at a time, as one great city.